And now it's time to wrap up the webinar. To summarize, we can consider in some mindings that VV-ECMO is an easy way to improve the oxygenation. The theory is very simple, and we give some blood with very high PO2 directly in the right atrium before crossing the pulmonary circulation, and high blood flow is allowed. But the reality is more complex, and there is a problem of blood recirculation. There is the problem of thrombosis and bleeding balance. There is a problem of hemolysis. There is associated organs failure, physical deconditioning, potential sepsis, and so on. And at the time where there is no lung ventilation at all and an insufficient oxygenation despite VV-ECMO, there is some ways to optimize the patient and the treatment, as we have seen during this webinar. First, of course, VV-ECMO allows to apply a very ultra-protective ventilation strategy, and this is very important to save life and save lung, of course, and improve the recovery of the lung. We have also seen that there is different possibilities for changing venous ECMO configuration, move to VV-ECMO or other possibilities. Cannulas and cannula's position are important, and there is also other discussion about that, about the biocompatibility of the pump, the cannula, and the circuit and the membrane, and also with some devices with lower risk for hemolysis. For example, the full magnetically levitated pump in the future, maybe it will be a good way. We also discussed about the optimal ECMO flow without recirculation and the possibility to have a control on heart rate and cardiac output with beta blockers, with short-acting beta blockers, and also to adjust the hemoglobin level. All these strategies may improve the delivery of oxygen to the organs. And when the right ventricle failed and there is an increase in the pulmonary vascular resistance and pulmonary arterial pressure, despite the VV-ECMO, there is some possibility to improve the hemodynamic and to improve the circulatory support in this patient. And at the end, this is very important to think about the rehabilitation and the early mobilization when it's possible for the patient and the VV-ECMO in our ICU. It's an important way to improve the outcome and probably, of course, the quality of life of patient in our ICUs. I would like to thank everyone for your attention, and the replay of the webinar will be available soon online on the EACTAIC ICU website. I invite you to join and follow the ICU sessions during the next EACTAIC ICU Annual Congress in Napoli, Italy on December 14-16. And this is my pleasure now to give the microphone to Professor Mohamed ElTahan, the chair of the EACTAIC ICU Education Committee, to close this webinar. Please, Mohamed.
Thanks so much, Professor Philippe, for your efforts. First of all, I want to express my appreciation on behalf of my colleagues and the board of directors of EACTA IC and the president of EACTA, Professor Patrick Waters, for the great efforts exerted by Professor Philippe Gaudard and the Professor Giovanni Landoni to organize this event, and for the esteemed keynote speakers which enjoyed us tonight, and it was very exciting event. Special thanks to the supporting industry from Eurosets, EOB and Trigger. I want to remind you first that this webinar is accredited by UEMS to provide 2 CME credit points. You have to complete the survey form following the webinar to earn this 2 CME, to claim this 2 CME points. And the special thanks to organizers from AIM Group, the Secretary of EACTA IC and Multi-Learning Canada for the providing of the platform and all technical support, and the people behind the stage. Also, I want to remind you, as Professor Gaudard said, that we have our annual Congress, and we are very excited to meet you face to face for the first time after 3 years. It will be in Nablus in December, 14 to 16. And we have EACTA still offering to you some delicious and heavy meals for online and on-site events until the annual Congress starting from October 24th. It will be the 4th episode of fellowship seminars provided from University of Perth on cardiovascular anesthesia in the Goldilocks zone. And the next one, it will be November 7th, and this is the 5th episode of fellowship seminars provided by Alice Olivier from Belgium. It will be on November 7th. Following this, so we have the serial webinar sponsored by Taba Medicine from China about lung isolation techniques, and it will be on November 19. And then we have face-to-face masterclass in Essence on ECMO and LVAD. It will be between November 25 to 26. I highly recommend you to attend this event to have the opportunity to meet the esteemed speakers and instructors with a lot of hands-on practice. Finally, I thank all of you for your devoted time to attend this event and support EACTA. More information can be found on the EACTA website, www.eactaic.gov. Thanks so much and have a lovely evening. Bye-bye.